Well, thank you very much. So this started in 2020. So we just had our fifth summit that we've done with the community. The goal of that project is to help people that do not know the cause of their kidney disease or don't believe the cause of their kidney disease or may have a misdiagnosis of their kidney disease to get what we call a complete diagnosis and to know not only that they have kidney disease, but also the causality and what caused that kidney disease. So we've been working in the community now since 2020 in the areas of public policy, healthcare professional education, and patient and caregiver education. Absolutely. Well, when you think about patients that we are trying to help with this project, I mean, many of them end up having a rare or genetic kidney disease. They may have diabetes or high blood pressure, in addition to those rare kidney diseases. But it's important to marry those things together because many of the things that help those patients, those rare kidney disease patients, also help in the diagnostic journey of patients. So one of the bills that we're working on, the Access to Genetic Counselors Act, as an example, provides Medicare reimbursement for genetic counselors to provide the service, as opposed to more costly physicians who may not know some of the genetic tests as well as genetic counselors do, who are really kind of the gold standard for that. So really, it's kind of a rising tide lifts all boats in that regard. We're working on those policy initiatives, and we can also learn from those rare kidney disease patients for what happened in their journey, where were the missteps, where were those missed opportunities, and apply that back upstream as we're trying to help other patients that don't yet know the cause of their kidney disease. Yes, well, thank you. So we had great success this past year with some continuing medical education courses for primary care physicians and nephrologists. But, it's one thing to do something online. It's a whole other thing to try to reach out into communities. When you think about the large academic nephrology centers around the country that are very well known, I mean, there's, probably a dozen or so that are really, really high end. They're not the ones that we need to convince on the importance of a complete diagnosis. We need to get out into the community for primary care physicians to try to pass those patients on to nephrology as quickly as possible. And for nephrologists and even urologists, as they're seeing these patients, and maybe they're getting a patient that's just come from the ER and they're in late stage CKD or maybe even needing dialysis, the importance of still figuring out what that causality is, because even if someone is entering end-stage kidney disease, there are things that need to happen to protect someone's kidney, family planning decisions, if it's a genetic disease, talking to family members, there's comorbidities, there's trials. There's a lot of reasons on why to do that. So reaching into those doctors that are really the ones that inevitably referred like those academic institutions are really where we feel like we need to do the most work. Yes, absolutely. Well, I think if you asked anyone that attended the summit, it's always the same, which is our patient panel. So one of our patients, just as an example, we really focused on the length of time it sometimes takes to get a diagnosis. We talked about sometimes what happens with a misdiagnosis, but I think really the most moving presentation was from someone who actually had gotten a diagnosis in her records like 16 years before. But in that time, she was on dialysis, got a transplant, lost a transplant. Finally, in working with us and some other projects, she asked her doctors, like, I really want to know what caused my kidney disease. They looked up in her record and found that she had been diagnosed 16 years ago via biopsy and had IgA nephropathy, but no one had ever communicated that to her. So, those kinds of things really moved the audience. But we also had some really great policy updates on the state of genetic testing guidelines and some suggestions from speakers on how we can work with those community physicians you talked about, the challenges with federally qualified health centers. One of our speakers mentioned that, they were helping a patient who was being seen for primary care at a health center, but for their insurance that they had to get to a nephrologist was a 4-hour drive and a 9-month wait. So how do we start to create some solutions on helping those kinds of patients? So really, those are all the kinds of talks that we had. But it was a really, really exceptional day. One of the things that came out of our Unknown Causes of Kidney Disease project is our Know Your Kidneys program. So our Know Your Kidneys website has 3 pillars. The first is called Know Your Kidneys. and that's for patients to put in information with their lab results, and it helps assign them a risk status for their kidney health, and then gives them tools to talk to the provider. But really, how it ties to this project is our Know Your Cause site, which is the second pillar of the program. And that's meant to help patients who are struggling to find out what caused their kidney disease, really have that conversation with their physician. So, it asks about family history. It asks about any symptoms you may have, for example, maybe hearing loss in some rare diseases, to really set a conversation guide for them to take to the physicians and talk to them. Since we've started that project, which is just since a few months ago, we've already had 3,000 patients complete that tool. We're seeing really interesting but also disappointing data from that. 7% of patients struggling to get a diagnosis have had no diagnostic tests from their doctor. Only 4% have had genetic testing. Only about 9% have had biopsy. So there's still a lot of work to do when we're talking about these patients who know that they have kidney disease, but still don't have the cause listed there. So we're hoping that not only the tool itself, but the data that we're getting from that tool will help the community moving forward.